Welcome, everyone. We are so excited to have you here with us today. Thank you for taking time out of your busy day to join us. The NCJFCJ and the CTRJJ to talk about our Trauma-Informed Courts and Pathways to Assistance webinar. And again, we are excited to have you here. I am Dr. Allison List from NCJFCJ, and we also have with us
Hi, everyone. Pleasure to be here. My name is Dr. Keith Cruz, and I'm the co-director for the Center for Trauma Recovery and Juvenile Justice. And Allison and I will be co-facilitating this webinar today.
Thank you, Keith. Okay, so before we begin, we just want to recognize that this webinar is supported by OJJDP. However, even though this webinar is in support of OJJDP, the points and opinions that we express in this presentation are ours and ours alone, and not necessarily the viewpoints or positions or policies of OJJDP or the DOJ. And again, I am Allison List. I'm the Program Director of Behavioral Health and Child Welfare here at the NCJFCJ. And we also have Dr. Keith Cruz with us today, who is the co-director of the CTRJJ. And we are going to be presenting an exciting new collaboration that we have and talking a little bit about the services that we offer. So to give you a little bit of background on us both, like I said, I'm the Program Director of Behavioral Health and Child Welfare here at the NCJFCJ, and I've been here now going on 3 years. Prior to the organization, I invested over 20 years to education. I was a preschool teacher. That's how I started out. Then an elementary school teacher. I then became a reading specialist at an elementary school. I was a behavior specialist, a school administrator, a school counselor, and later a professor. And my life has been dedicated to improving the quality of life of children and their families and the systems that they operate in. So when I came to the NCJFCJ, I was really excited to move to more of a macro systemic type of being, a larger impact where I could see nationally things that we were working on, a different way to serve families. I won't read my bio in full detail to you, but we do focus on in the behavioral health department. We are our own department, but we're integrated into every other department at the council. So I work also in juvenile law, in child welfare, in family violence and domestic relations. I also work on projects at our research facility in Pittsburgh called the National Center for Juvenile Justice. And I also oversee our Judicial Wellness Connection and Leadership Initiative, which focuses on judicial wellness. And what's really neat about that initiative is that we are the only organization that has coined that judicial leadership is actually, or judicial wellness is actually a form of judicial leadership. So that's really exciting. And I'm going on my 3rd year here, and I'm looking forward to being able to help families now more in a more larger and systemic, broader way. Dr. Cruz?
Thanks, Allison. So once again, my name is Keith Cruz, and the Center for Trauma Recovery and Juvenile Justice has actually been in existence. And I'll tell you a little bit more about that throughout the webinar, but it's been in existence for 15 years. For the past 3 years, I've been serving as one of the co-directors of our Training and Technical Assistance Center. But I'm a licensed clinical psychologist in both New York and Connecticut, and I'm also a faculty member at Fordham University. My entire professional career has been spent working in the intersection of adolescent mental health and juvenile justice, and I've worn many hats through that work as well, both from the perspective of designing services and implementing services, but also doing lots of training and consultation with juvenile justice staff, including lawyers and judges and probation officers and mental health clinicians as well. But I also bring the frame of, conducting independent forensic evaluations of youth who intersect the juvenile justice system as well. And through the CTRJJ, we have a robust faculty who has been working to support the infusion of trauma-informed practices for youth and families in the juvenile justice system, which I'll be speaking to later on today. And I've been super excited to be working with Allison and other members of the NCJFCJ on the Trauma Pathways Collaborative.
Thank you. To give you a little bit of background, if you're not familiar with the NCJFCJ, we are the oldest judicial membership organization in the nation. We just turned 88 years old this past May, and we're now moving into our 89th year and couldn't be more excited. We have served 30,000 judges and court professionals, and our work positively impacts 4 million families annually. We have 4 core values that we operate from internally and also through our external deliverables that we push out nationally, which is compassion, leadership, education, and community. And we have multiple areas of focus across our organization that you can see on this slide here. I won't read all of them to you, but our touch nationally goes very, very far. DEI and justice, family law, behavioral health, child welfare, and juvenile justice, just to name a few. As I briefly mentioned before, we do have a research division. It's located in Pittsburgh, Pennsylvania, called the NCJJ, the National Center for Juvenile Justice. And we have been publishing in the areas of child welfare and juvenile justice since 1973. So today, here are the 3 main things that we're going to be talking about with all of you. We want to be able to review our trauma audit process and what courts will gain and benefit from us on a small scale. We're going to introduce the CTRJJ and how they support a sustainable trauma-informed process from a systemic lens. And we're also going to discuss how courts can evaluate their readiness and commitment to having a trauma audit. So as we begin, I want to talk to you a little bit about our history and commitment that we have had to help courts be more trauma-informed. So working in the trauma space has gained a lot of traction over the past few years. I think that no matter what sort of social media platform you log on to or news outlet that you read or whatever that may be, the word trauma comes up often. There are a lot of people working in the trauma space. However, for us, over the past 88 years, we have been known as innovators in the field of judicial education. And while we haven't been specifically addressing the actual word trauma for 88 years, we have historically provided education and training for judges on how to best practice, to implement best practices to achieve the best possible outcomes and positive outcomes for family and children. And that could be argued to be a trauma-informed practice. We have worked for close to 20 years with the National Child Traumatic Stress Network to further our research and responses to children and families in the system. And we are the first organization to have ever developed a trauma consultation process and related technical assistance services for courts. And because of this, our track record in this area has really made us the trusted TA provider across the nation for trauma-informed recommendations in the court system. So I realized that this slide might be kind of hard to see, but I wanted to be able to show you a timeline of how long we've been involved in this work. Back in 2008, that's when we first partnered with the NCTSN, and we worked on a publication that explored the landscape of judicial knowledge in trauma-informed care and juvenile justice. So a couple of the things that we wanted to know with this service brief was, how much do judges actually know about trauma? And related to that, what type of education do they need? And with that, over that data collection process, that really helped inform our formal process of developing a trauma consultation protocol for courts back in 2013. And from there, we also developed a bench card with the NCTSN, a trauma-informed bench card. And as you can see along the trajectory, we have had time and time again places within the trauma space to be able to address courts. We held our first NCJFCJ National Trauma Summit back in 2016. We held our second one last summer in 2024. We were able to provide during COVID-19 virtual trauma consultations, which was a really innovative way to pivot and help courts and families in that way. In 2022, just to show our commitment to the process, we revamped our trauma audit process. And we solidified that new process just a few months ago. And we just this summer released another ACEs bench card. We also developed a resolution on trauma-informed courts back in 2015. And with that, I won't read all of these points to you, but I will highlight a couple. We really urge stakeholder engagement, and we believe that this includes working with families and using family voice. We also believe that work collaboratively across micro and macro systems to help inform policy, to help inform practice, to help improve environments, and that's really important to do with those with lived experience. We also recognize that small changes hold really big results that support safety and healing. What is a trauma-informed process if you're not supporting healing and safety? We support the judicial education on trauma is crucial, and this includes vicarious trauma. This isn't just working and addressing and being responsive to the trauma that families come in with, to what they're experiencing in the court process, but also what court staff and leadership teams experience on a daily basis. We focus on application and science and continue our ongoing engagement in this work. And if you go back and look at our timeline, you can see that we started this process back in 2013, we revamped it in 2022, and again, we finalized it in 2025. So our work, we recognize that families coming into court more than likely have a trauma exposure, and we can reduce that impact through specific interventions. We assess court practices, we evaluate the environment, we scan policies, we interview court teams to collect a more holistic picture or snapshot of your court. And what we really do is in our process, we focus on answering the following questions. Is there a demonstrated understanding of how trauma actually impacts the actions of those in court? Do our court teams actually have a solid foundation or understanding of that? And to what degree? How are we engaging families and parents? How are they engaged? How are they treated? How are connections maintained? What does judicial compassion and therapeutic jurisprudence look like? Screening. Is there a trauma screening protocol in place? We want to know that and help courts get that put in place. What are the resources and how are they referred? How do families get connected to resources? When you hand a family a resource, how are you making sure that they're being followed up on? What barriers are identified to resources? What does the environment of the courthouse look and feel like? And is there an understanding of the impact of vicarious trauma? So our results. We know that by attending court by nature, it can be traumatic. So juvenile and family court judges are positioned uniquely to be able to be leaders in this work. Since 2013, we have provided trauma audits in at least 27 states across all different diverse types of courts. And with some of our top recommendations, although we tailor them specifically to every court, there are consistency in what our top recommendations are. And that has been establishing a trauma screening protocol, providing signage in multiple languages to make the process a little bit easier for families, making the courtroom more family and child friendly, and the recommendation of creating separate waiting rooms for victims. We pride ourselves in being able to say that we truly meet every court team where they're at in the change and implementation process. So our vision. Judges and their teams and all related stakeholders really need to have a shared understanding of trauma and how it affects youth and trauma responses that we see of families involved in the system. We need to have the capacity to be able to respond effectively, which means that we're addressing vicarious trauma at the same time, because we have to have the capacity to be able to lean in and help. We want to create a healing environment that promotes safety and meaningful social connections. We want to make sure that we have resources available for families. And we recommend that there is funding available, or try to find funding available for policy and practices to enhance the response to victims. So our commitment is to train courts to be informed and responsive to the harmful effects of trauma, to reduce re-traumatization, and to increase a sense of safety for positive outcomes. We believe in the power of pro-social connections and maintaining those connections for youth and families and court staff. So to get into a little bit more detail, here's how we can support courts. Our process is there's a specific entry point. Either we get a request from a family court or a dependency court to come out and do a trauma audit, or else we might be in conversation with someone or at an event and realize that someone might be in need of a trauma audit, and so we'll offer that. Either way, there's multiple entry points. Once we have established that that court that needs assistance has judicial support and that's been confirmed, we start the whole intake process. So we start to collect data, review your policies, review your procedures, and then we start to establish team rapport, because we know how important trust and safety is. We also want to make sure that we have that established with your team before we come out on site. We come out on site for 2 to 3 days. We observe your court hearings. We walk around the courthouse. We observe the court environment. We collect data on those pieces, and we do an environmental scan along with our court hearing observations. We hold team interviews with your leadership staff. And then after we're done with our court hearing observations, we do a brief debrief on what are our initial findings over the past 48 hours. And then we have a formal report that's sent to you within 45 days with tailored recommendations for how your court can be more trauma-informed and trauma responsive. Overall, the process takes about 2 to 3 months. And what's great is that this is supported and funded by OJJDP, so at no cost to you, we will come out and provide this service. So how are we enhancing and strengthening our service? Originally, we started out this process in 2013 when we were calling it a trauma audit. We then transitioned from calling it a trauma audit to a trauma consultation. We have decided to go back to the original name because the meaning of the word audit really is a systematic review. And knowing that that's the conceptualization of that term, it does align with the direction that we're taking this process with the CTRJJ. And so we're really excited to go back to our roots, calling this the original name that we had it from before, and then enhancing the services that we're able to offer. So again, when you're looking at a trauma audit from our perspective, this is a microsystems approach. This is boots on the ground. We're coming directly into your environment and we're taking a snapshot, if you will, of your process. We refined the review and the data collection process so far to be more tailored to your needs. We will now be bringing additional expertise for our site visits. So we have judges that are trauma trained that come with us. We'll bring lawyers on site. We have external national trauma experts to join our internal team of experts to go along with us on our site visits. So we have multiple perspectives when we are doing court observations. We're going to be working more closely with our research division on the data collection piece and pushing out trauma publications. We have now recommendations that will be specifically tailored to observations. And while we provided that before, we will uniquely link that to our enhanced resource guidelines and to trauma science. Again, we have a 45-day window that we will be giving you a site visit report back in order to help you along your change process a little bit quicker. However, we do know that the word change and quickly don't usually go together in the same sentence, but we aim to get that report back to you as soon as possible so that you can start your internal work. We started hosting quarterly collaborations with national trauma experts. In these spaces, we talk a lot about what are we currently working on for proposals, what new research trends and ideas are out there, what are we working on, what are the goals of our organizations, and how we can support each other collectively to help move this work forward within a trusted group. We are infusing and incorporating more education on vicarious trauma and secondary traumatic stress into our trauma audit process, having those conversations with internal teams and with your court leadership teams. We're infusing that into our TA, into our conference presentations, into our webinars, and into our Judicial Leadership Wellness Initiative. And we've now just recently expanded our trauma audit process to our Safe Babies courts through 0 to 3. And now we're going to talk a little bit about what our enhanced partnership looks like and why we're building upon our collaborative history. So in order to be strategic in moving forward and best address the needs of our courts and families, it was really important for us to look at who were the original partners on this project. Where did that collaboration begin and where can we build upon that? So when we go back and revisit our history timeline that you saw previously, we know that we started working with the NCTSN back in 2008. And what a better way to be able to announce our new collaboration with the CTRJJ is through looking at what that history was like, starting back in 2008 and now moving forward together. We're really excited to be able to do that again. So who do we serve individually and collaboratively? What better way to look at it than a Venn diagram? Over to the left, you can see that through us, NCJFCJ, we focus in the child welfare space and we focus in Safe Babies courts in providing these trauma audits. We also provide audits that address crossover in dual status youth. And what's really exciting about our work with the CTRJJ is that they specialize in delinquency. So together, we are really looking forward to overlapping our processes for a more holistic process, but also honoring the fact that we also offer individual services. So individually and collaboratively, we really have a great process to lay out for you. And I'm going to hand it off to Dr. Cruz now to talk a little bit more about the CTRJJ.
Yes, thank you so much, Allison. I'll just be building off of this really important work that Allison is describing with the trauma audits, to be describing a little bit of what the CTRJJ can offer along this pathway as well. But for those of you who are unfamiliar with the CTRJJ, once again, we are the Center for Trauma Recovery and Juvenile Justice, and we are what is known as a Training and Technical Assistance Center that is affiliated with the NCTSN. And if you're not familiar with the NCTSN, that stands for the National Child Traumatic Stress Network. And our funding comes from the Substance Abuse and Mental Health Services Administration. To our knowledge, we are the only training and technical assistance center through the NCTSN that is specifically dedicated to enhancing trauma-informed policies and practices and procedures within the juvenile justice space. And that really represents the mission of the center. We work on supporting a comprehensive framework for developing, adopting, implementing, and sustaining evidence-based trauma-informed services for all youth that come into contact with the juvenile justice system. And supporting youth also means supporting families. And supporting youth and families also means supporting the workforce that are working directly with youth and families as well. And finally, consistent with our discussion here today, the CTRJJ historically and currently also focuses attention at the system level, working with leaders within local jurisdictions and even at the state level to support the infusion of trauma-informed approaches at the system level. And so many of you are familiar with this, and so I won't belabor this point as well. But if we go to the next slide, Allison, most of us are kind of familiar with the 4 Rs to a trauma-informed system. And this comes from SAMHSA and has been articulated in 2014 and really represents aspirational guidance and principles of what it means for any system, including a court system, to be trauma-informed. And the first point, Allison, if you would just narrate that, that'd be great, is really realization that everyone in the organization has an awareness and understanding of the impact of trauma across the services and settings and populations worked with. The second R is that there's recognition across the organization, that all individuals within the organization recognize the signs of trauma in youth and families and also staff as well. And the third R is we do this then through appropriate responses. So a trauma-informed care approach at the systemic level views trauma through an ecological and a cultural lens and really recognizes the context plays a really significant role in how individuals perceive and process traumatic events, whether they're acute or chronic. And therefore, at the organizational level, we really need to think about the language, the behaviors, and how trauma-informed practices are infused in the policies that impact the youth and the families that we work with. And ultimately, we need to think about doing all of this work as a way of trying to resist what I would refer to and what SAMHSA has referred to as re-traumatization. And another way of framing that is we want a youth and family to experience within our work a trauma-informed approach that minimizes the likelihood of reactivating those traumatic experiences through our interactions as well. Now, in many ways, these are system-level aspirational principles that are very broad and they're very helpful in thinking about guiding our work. But what we've also learned through our work through the CTRJJ and the NCTSN is that systems require some additional guidance. So we can look at another level of guidance around what it means to be trauma-informed in going to the next slide. And both the CDC and SAMHSA have supported that there are 6 guiding principles to a trauma-informed approach. And they're represented, and I won't belabor them here for the sake of time today, but they include things, very important principles of things like physical and psychological safety, trustworthiness and transparency, the power of peer supports and collaboration and mutuality. And a challenge that we know in working with systems is that I think while we could all agree that these are very important, a challenge is that this doesn't represent, and truly being trauma-informed is not accomplished through a single training or attendance of a webinar or offering or attending a conference. So it's not a single technique or checklist. It requires at the system level some constant attention and awareness and sensitivity to the idea that this really represents oftentimes a cultural shift within organizations. Being trauma informed also, and I'm seeing some of the comments in the chat here, really require a full engagement of all of the partners within a given, in this case, court system, and full engagement and being willing to sort of work alongside the youth and families as co-creators and co-collaborators in this process as well. Um, so this sort of serves as some guiding overarching principles for our work. And what we've really recognized um, is that systems need more guidance, particularly in the juvenile justice space. So moving to the next slide, Allison, is I had the really great experience of back in 2015 working through the CTRJJ with members of the NCTSN Justice Consortium to translate and operationalize those 4 Rs and those 6 guiding principles into more definable practice standards. And we released a document back in 2015 called The Essential Elements of a Trauma-Informed Juvenile Justice System. And while it's written in more operational language, what you can see here is that we consider that there are 8 essential elements to a trauma-informed juvenile justice system. And that includes many of the things that Allison referenced that can be covered in the trauma audit. It's everything from reviewing policies and procedures to thinking about universal screening procedures, follow-up clinical assessments for youth who may be screened in, and then access to intervention, but then also moving to training and support around secondary traumatic stress, how it is we're partnering with youth and families, and how we're engaging in good cross-system collaboration to support the work of being more trauma-informed, and also really recognizing that there are differences and disparities and diversity that need to be taken into account as well. And this is a document that is available on the NCTSN website and also on the CTRJJ website. And moving to the next slide is once the essential elements document was released, we heard from some courts that they were attempting to conduct a review to kind of use that essential elements document as a way to examine their court practices. And then they reached out to the NCTSN and the Justice Consortium and said, we need more guidance. And that more guidance was in recognizing that the essential elements document didn't provide the type of concrete guidance to courts to conduct the type of review of evaluating their practices and procedures. So members of the Justice Consortium set out to translate those essential elements into a practical document that translated those elements into what we call tangible benchmarks that could be reviewed, rated, and summarized to inform the court on their current practices. And that became the Trauma-Informed Juvenile Court Self-Assessment. This reflected a partnership with the NCJFCJ, and this document was released in 2019. Like I said, it's informed by the essential elements, but it was not ever intended to replace, but to complement the intensive on-site process of the trauma audits offered by NCJFCJ. And through the release of this document, we heard back from courts and the piloting that they thought it was a flexible and feasible and really functional approach, but yet they were still asking for more guidance. So I want to offer just a couple of quick perspectives on what's included in the original TIJCSA, and then I will be expanding on what we're now unveiling as a more facilitated approach to use of the TIJCSA. So there are 5 broad steps that courts can go through that are reflected in the original TIJCSA. It's forming a self-assessment team. It's conducting the self-assessment by rating what we call element benchmarks. Then it's a process of team-based review of those element benchmarks to what we call an element summary rating. And then utilizing that information for the process of thinking about system improvement and developing a plan for how to try to accomplish that as well. These are all steps that are articulated. And if you download the Trauma-Informed Juvenile Court Self-Assessment from our website or from the NCTSN, you will recognize that these are 5 steps that are still part of the process. Now, I'll take just a moment to describe the TIJCSA in a little more detail. And so if you move to the next slide, here's an example of 2 element benchmarks from the tool that relate to that essential element number 2, identification and screening of youth who have been traumatized. So this is what we mean by more operational language. You can see that benchmark 2A focuses on whether or not that a court would have a written policy and some key details of what should be included in that policy for it to be considered to be trauma informed. The self-assessment team could also look at the screening practices that are utilized within that court system as well. And you can see that there's a sort of guidance around how to rate that as a practice. Is it a practice that is currently not evident in our system? Is it a practice that we've thought about but yet haven't implemented? Is it an informal practice as isn't accessible to all youth? Or do we have this as a formal and then a sustained practice as well? So these are some examples of how we've attempted to operationalize through concrete benchmarks some of those essential elements. In this case, just 2 examples of benchmarks for the process of, a universal screening. From that as well, another key part of the TIJCSA is giving each of these essential elements an overall rating. And so if you go to the next slide, Allison, is we are drawing on, an overall element rating that is anchored in helping to describe the level of implementation and the implementation support that has occurred around that process. And this element summary rating is informed by what's known as the EPIS framework, which essentially identifies that there are 4 different stages of system change that can be guided by implementation science practices and principles. Now, that all sounds very fancy. In translation, what this means is that going through the TIJCSA and rating those element benchmarks, the team can come to a conclusion. Are we at the exploration phase of screenings? Are we at the preparation phase that we've done some work, but we haven't yet effectuated this practice? Is this something that we've implemented? And could we consider it to be adopted? And have we adopted it and build in supports for this to be a sustainable practice as well? Also included in the next slide, another important component that you'll find is the structure of the TIJCSA is supporting some strategic planning. So each element has a template, basic strategic planning worksheet that the team could utilize to outline and communicate and to begin to discuss a strategy for improving those court practices. Now, as I mentioned before, the TIJCSA, it's really been identified as a self-assessment, and it was intended to serve as a guidance point for local courts to be examining their process. And while there has been some good uptake and benefits for the TIJCSA, we routinely hear from courts is that they could use some additional guidance and support. And so what I'm here to describe today is what the CTRJJ is launching and what we're calling the facilitated approach to use of the TIJCSA. And so you can go to that next slide, Allison. And that's what I'm going to be transitioning to now, is describing what we mean by this facilitated process. And I'll try to break this down pretty quickly here. So this will be a little bit of a top-level overview. But the CTRJJ is offering what we're calling a 7-step facilitated process. That first begins with step 1, where we introduce the court to the TIJCSA and the facilitated process. And that's providing some basic framing up of what can be accomplished through the TIJCSA and helping to provide some information on, is this a good fit for the court and what the court would like to try to accomplish. That will lead to the second step, which is we will meet with key decision makers from within a local court system. This is oftentimes a presiding judge or our court administrator that has been empowered by a presiding judge to begin to examine, are we as a court ready to tackle and to take on a review utilizing the TIJCSA? So we will meet with a key decision maker with a focused interview on some what we call initial engagement. And the purpose of this focused interview is to determine what a court's local goal is for potentially engaging in the TIJCSA. Where are you currently in your trauma-informed practices? And are you ready to tackle and to take on the TIJCSA? And are you, as a leader, can you create and carve out essentially the time and the resources to support the full maximum benefit of use of the TIJCSA? That's all step two. And then in step three, we will offer guidance on how to include and to develop your self-assessment team. Now, this is where the TIJCSA differs from the trauma audits. The trauma audit process will have an embedded external team come to your court to engage in that more micro process as well. Through the TIJCSA, we will help a local jurisdiction form a self-assessment team that is best aligned with your goals of what you'd like to accomplish through this review. And we will help you form your self-assessment team using strategies for team building that's informed by what makes for a really successful teaming process. Um, then our next step is really how it is that we're going to support that team. And so we will do one or two meetings with your team to launch that team process as well. We will meet with your team virtually. And because we want to ensure that there is a good consensus amongst the team on why the team is there, what is the task to be accomplished, and essentially providing a roadmap, if you will, for how that team will do the work of the TIJCSA. Step number 5 is then the CTRJJ is compiling a combination of static resources and live, and I mean by virtual, I mean live, by offering virtual trainings to the team on how to then engage the assessment process. We will provide resources and instructions on each of the elements that the team may be reviewing from the TIJCSA, because we want each team member who's actually going out and conducting the assessment locally to have a good understanding of each element, the benchmarks, and the types of processes and procedures to best inform making those benchmark and those overall element ratings. And then the next step through our facilitated approach is then assisting that local team with reviewing the data and engaging in a process that we call sense making. And this is a guided, facilitated process that the CTRJJ will provide that will really help the team lift out what the team has learned from the TIJCSA and from each element, and helping to establish some initial priorities for system improvement. And then our facilitated approach will end by what we call a revised strategic planning process. We call this strategic thinking and action planning. Essentially, the CTRJJ will provide a 1 to 2 meeting process by which the team is convened, and we will help you establish the 1 to 2 steps that the court could take over the next 3 to 6 months to move the court system forward towards a more trauma-informed approach, and establishing a specific timeline and tasks that would be needed in order to achieve that step of becoming more trauma-informed. So in ways, Allison has already described that the TIJCSA is really anchored in the essential elements of a trauma-informed juvenile justice system that is anchored more on the delinquency or that crossover or dual status youth process. But we refer to this as a more macro level or a macro systems approach as well. And what we mean by that is we're going to consider that the courts are often conveners. And that there are going to be a range of services under a typical delinquency docket that the court will have some oversight or connection with. This could be diversion, this could be probation, this could be short-term detention, or the services that a youth may receive post-disposition, whether it's in the community or through placement. The TIJCSA allows the court to think about what other components of the system would be important to take into account and to include in that TIJCSA process. So rather than focusing on the more micro, what a youth and a family may be experiencing while they're in the court itself, the TIJCSA can help take a step back and look at the types of services that a youth or a family may be engaging in across the system as well. So from this perspective, we think that there are 5 characteristics for this facilitated approach. The first is process. We provide the courts with a method to review and evaluate those 8 essential elements of a trauma-informed juvenile justice system, while yet allowing the court flexibility on how many of those elements a court may want to take a look at through the TIJCSA. Some courts may choose to do all 8 elements. Another court may decide we want to focus on 2 of the elements, and we can offer a facilitated process, whether it's 1 element, 2 elements, or all 8. The second is a framework. The benchmarks in the TIJCSA and those overall element ratings provide a clear framework by which the court can review trauma-informed principles and practices, and to help and to think about how this could involve some good engagement with court partners as well. The third principle of this is it really relates to also system enhancement. So the TIJCSA is really a template for a trauma-informed approach, but our facilitated guidance and through the development of the assessment team makes it live. It is a desire, it's a clear process for system enhancement. You're taking the template, but then you are then filling in the template with local data, utilizing local expertise, also supported by the CTRJJ. And it really can highlight those existing trauma-informed practices and provide a clear signal of where the court can move to enhance their system as well. And from that, and it's very consistent with the trauma-informed approach that's also represented through the NCJFCJ audits, is collaborative decision-making. What we know is that trauma-informed practices in the juvenile justice system should not be siloed. They're not the responsibility for only one component of the system. So we want to think about building effective and sustainable practices. It's reinforced through an active collaboration and across the system. So the TIJCSA is built on implementation science principles and strategies that really take this more organizational change perspective. And this is really practically anchored in the formation of that self-assessment team who's represented on the team, both from inside the court and also court partners that could include members from the community and youth and families as well. And by bringing the team together, it can support that team in reviewing the system and then having a greater understanding and knowledge of the system and its strengths and limitations, but then also you will have the right people at the table that can determine your next steps. And that's that strategic thinking in action. So, and the CTRJJ would conclude the facilitated process by then helping that assessment team have a clear roadmap for some establishing 1 to 2 immediate priorities, what those priorities are, why it's important, and some definable action steps that the court would need in order to support putting those into action. So if you'd like, and so we're going to wrap this up and then open this up for some questions as well. But I want to, we can't attend a webinar without having an obligatory QR code in it these days. But if you would like to connect with the CTRJJ and learn about some of our other resources that are listed here as well, including how to gain access to the trauma-informed juvenile court self-assessment, there's a way for you to connect with us here. We will also be making this recording available and including some additional follow-up. So in case you can't scan this from your computer or with your phone, we will provide continuing ways for you to connect up here. So in concluding, we want to sort of describe this collaboration and with some clear guidance around some takeaways for some pathways and examples of how CTRJJ and the NCJFCJ are working together in a collaborative way to support more trauma-informed and trauma-responsive courts. So we are very excited about this mutual collaboration and ways that these 2 different processes can work in tandem and can complement one another as 2 complementary pathways to support courts on their journey to adopting and sustaining trauma-informed practices. Our organizations in developing these processes, we are drawing within our teams and across our teams on subject matter expertise within both organizations to support the processes and the delivery of technical assistance. Collectively, we share the commitment to advancing trauma-informed practices that are aligned with the goals and needs of your local court. And here are a few points to keep in mind if you're considering what pathway is the right fit for you. The NCJFCJ trauma audit process is focused on supporting courts that are clearly anchored in a child welfare docket and focuses on practices and policies inside the court. That's a kind of idea of being that more micro system. The CTRJJ through the TIJCSA is focused on supporting courts with primarily a juvenile delinquency docket and focusing on those practices and policies across the court by engaging in court professionals and court partners at the macro system, bringing them to the table to form that self-assessment team as well. It's really important to recognize, though, that jurisdictions and that have both dockets that include both crossover and dual status dockets may find that either the trauma audit or the TIJCSA could be a beneficial process as well. But regardless of what pathway a court may choose, please note that the NCJFCJ and the CTRJJ are committed to ensuring that each court leaves the process with a set of recommendations or a plan on what to prioritize next. That can inform enhancing a court process that maximizes and fits with your local priorities and needs, and that can lead to actionable change. And within the next year, as Allison alluded to, the NCJ and the FCJ and the CTRJJ we will be offering these services to jurisdictions, through our various grant-funded mechanisms, and either of our organizations can help you to determine what path is the best fit for you. Another way of thinking about just real practically that the trauma audit perspective is usually may be from start to finish a 2 to 3 month process. And depending on local needs and how much of the TIJCSA that you might want to take on, we have envisioned we can work and provide the facilitated approach, and that we would recommend that you might want to think about at a minimum of a 3, but likely to a 6-month process to fully engage in all levels of our facilitated support as well. And while you may be curious around this or which one is the best fit for us, is what we will recognize is that through this collaboration, we will help you in our initial engagement process to determine what path can be the best fit for your court. And so you can utilize information here on this next slide for contacting either myself or Allison through our individual emails, or to contact the NCJFCJ or the CTRJJ to inquire more about either of these pathways as well. And so we want to end there to leave with enough time for some questions and comments. And Allison, this is probably the thing that we really didn't think about, like how we want to try to narrate this as well. I know we've had a lot of really wonderful comments that have been emerging in the chat as well. But we're happy to sort of think about additional questions or comments that we could try to field in our remaining time.
Yep, that's great. So I'll just watch these kind of filter through into the chat, and I can call out some questions that we're getting, and we'll go ahead. And just to reinforce this idea that after this webinar is over, we will be sending out a follow-up email. It'll have all the information in there that you need, who to contact. I cannot stress to all of you enough that if you're not sure who to contact, we can both guarantee you that whoever you email to get information from, we will make sure that we get you set up with the right fit. Whether it's you emailing me for information and I think that, it might be better for you to speak to Keith over at the CTRJJ, and vice versa, we will make sure that you get what you need. We all appreciate you coming, so thank you so much. And let me see here what's coming in now. We have a testimonial from Judge Tepper. Thank you so much. Said she was fortunate to have a Project 1 NCJFCJ model court undergo one of their earliest trauma audits, and how beneficial it was for them to experience that. So thank you, Judge Tepper, for jumping in the chat and sharing that. That's great.
Allison, I'm seeing a lot of comments on and really representing, I think, what has been a good shift in the way that we approach trauma-informed system support, and that is involving youth and families as co-collaborators and making sure that we're involving individuals with lived experience as
Mhm,
well.
mhm,
This truly does represent the essence of what it means to be trauma-informed, and I think we also appreciate that there can also be tension points within that as well. Um, so we take a very careful and deliberative approach to working with a court through the CTRJJ on the inclusion of youth and families or other individuals with lived experience. And we will talk about the ways of and the importance and relevance of including them as part of the self-assessment team. Um, there are also ways that we will guide a court to make sure that those individuals truly feel that this is a collaborative process and that they are supported through that work as well. But I think we are all committed to ensuring that we need to really be involving youth and families and other individuals with lived experiences that would be receiving and engaging in these services. That is that when we're really thinking about being trauma informed and thinking about what we can do to move that forward, those voices and perspectives need to be represented at the table.
mhm, mhm. Agreed. We had one question come in from Carla who would like to know some examples of what recommendations have been implemented that have made the biggest impact for being trauma informed. And I can share a few of those with you. When we do the environmental scan and we walk around a courtroom property and in the courtroom itself, we are looking for multiple things. And one of the things I had mentioned before, which one of the highest recommendations, was to make sure that we have signage in multiple languages. But one of the other things that we've done is asked everyone in the courtroom to introduce themselves when families come into the courtroom so that they know who is in the courtroom with them, what are their roles, what are their responsibilities, just to ease some of that anxiety and stress that families may feel when they come into the courtroom, being addressed by whatever name that they're choosing to be addressed by instead of mom or dad or whatever that may be, giving families more of a voice and a choice in how they want that process to go. Being spoken to, not about, when they're standing in the room is also really important. And we have some more publications on that I can send out just for the sake of time. That when we send out our follow-up email, I can link in some of our publications as well.
And Allison, if I could address too, with this as an example of a good practice, because I think that this was referenced as well, is I've seen that incredibly valuable benefits to moving a court forward through the infusion of appropriate and universal trauma screening. And oftentimes in a juvenile justice context, this could occur either at the point of diversion or at the point of thinking about, uh, you know, uh, like probation intake, for example. Um, we have to know if a youth is currently experiencing what they've experienced and are they showing some active trauma reactivity and how that information is communicated uh, you know to the court and how that's related to services as well. And so that's one practical example. And because there's many is like, well, what does that screening process look like? What is a good screening practice? um, Now that's a hard question to answer because oftentimes that's connected to local decision making. But what I can tell you is that the TIJCSA would provide you some tangible benchmarks for what that practice can look like, that then you can benchmark, how that would look within your court as well. And I think it's really important to also understand, and the final comment that I will make here around this is the TIJCSA is not meant to give a court a grade. It's not meant to reflect that, we are either trauma informed, great, we've met some threshold, or not. As the purpose of the TAJCSA is to provide that evaluation and to determine where your practices and how far advanced they are, or if they aren't present at all. And from that, the benchmark ratings, if you will, while it does kind of sound like giving a grade, you're not summing them to conclude if you are trauma informed, yes or no. It's to serve as a benchmark of where are we? Um, Uh, and where is this practice at in terms of its stability and its reinforcement? And then how can that inform how we would engage in some strategic planning?
That's great. Well, everyone, thank you so much. It seems like we have a lively discussion happening in the chat with bouncing some ideas back and forth. We appreciate your participation. Thank you so much for joining us today. A follow-up email with all the information that you need will go out. And please contact either Dr. Cruz or myself if you have any questions, and we will make sure that we get those answered for you and link you up with the proper resources and people that you need to speak with. So thank you so much for joining us today, and we hope you enjoy the rest of your day.